So pregnant women, as well as doctors and midwives, are asking what to do. Well, the symptoms and advice regarding travel, isolation period, and the medical management of the infection are the same in pregnant women as well as in non-pregnant individuals. So what's specific in pregnancy? Well, there is no evidence that coronavirus increases the risk of miscarriage. There's no evidence that the virus crosses the placenta from the mother to the baby, but there is evidence from case reports that it might increase the risk of preterm birth. But it's still not clear whether this is increasing spontaneous preterm birth or iatrogenic, i.e. medically indicated. And the Royal College of Obstetricians and Gynecologists, in collaboration with the Royal College of Midwives and the Royal College of Pediatrics and Child Health, have published guidance on coronavirus in pregnancy. This guidance is available online and is free to download. Each country has its own guidance on who to contact if you have been exposed or have symptoms of coronavirus, and therefore you should follow the guidance where you live. For pregnant women in the isolation period, the advice is to try to postpone routine appointments or ultrasound scan or induction of labor or planned cesarean delivery until the completion of the isolation period. Do pregnant women need more scans, more ultrasound scans? Well, there is no evidence that the virus crosses placenta. However, if you extrapolate from the evidence on the SARS infection in pregnancy, 2/3 of these pregnancies have fetal growth restriction. And therefore, it seems that ultrasound scans to monitor the fetal growth are recommended. What about in urgent circumstances? So, for example, pregnant women going to labor or developing an obstetric complication or are very unwell. Well, the advice is to contact the hospitals or maternity services, and when you come to the hospital with a private transport or an ambulance, we need to provide the urgent medical treatment that's required, but we also have to follow the precautions about on using personal protective equipment in order to reduce the risk of transmission. What about in labor? Well, continuous intrapartum fetal heart monitoring is recommended in view of the risk of intrapartum fetal distress. These women are not necessarily advised routinely to have a cesarean section. Cesarean delivery is indicated for the usual obstetric indication or if the woman is very unwell. What about pain relief in labor? Well, there's no evidence that epidural or spinal analgesia or anesthesia are contraindicated. In fact, having epidural at early stage in labor is probably a good idea in order to minimize the need for general anesthesia. We must remember that the coronavirus can cause pneumonia and respiratory failure. Finally, what about the advice regarding breastfeeding? Well, it is controversial and evidence is limited. There is no evidence the virus is secreted in the breast milk, and therefore we need to balance the benefits of breastfeeding versus the risk of transmission to the baby. And therefore the options are either to express the breast milk and during isolation periods, or to actually breastfeed the baby but follow strict precautions to reduce the risk of transmission to the baby, such as hand washing and using a surgical mask during breastfeeding.